Walking is often the most underestimated form of exercise because it is so simple. But precisely because of that, it sends a regular and sustainable signal to many systems in the body: your heart, muscles, blood sugar, stress level, and even your sleep. All of them can be affected by this simple movement. So, what really changes? What is exaggerated, and how much walking is enough? If we think of walking only as burning a few calories, we actually miss a large part of the topic, because regular walking is connected to many systems in the body, from the heart and blood vessels to blood sugar, muscles, joints, and the brain. More importantly, walking is a sustainable habit for most people. Very intense exercises can be challenging for some individuals, but walking can be a realistic starting point for moving toward a more active life. So, what does regular walking really change in the body? In this video, we will talk about the scientifically strongest benefit areas of walking, the points that are often exaggerated, and its realistic limits. First, let's make one thing clear. This video is not built on claims like, if you take 10,000 steps every day, all your health problems will be solved, because health is far too layered to be explained by a single habit. Sleep routine, nutrition, stress level, genetic traits, age, existing illnesses, smoking, work pace, and overall lifestyle all affect how the body responds. Walking can be an important part of this picture, but it is not the entire picture itself. What we will talk about here is this: when regular walking is done, especially at a moderate pace, which biological processes does it activate in the body, and which health outcomes are these processes associated with? We can think of moderate-paced walking simply like this: your heart rate and breathing increase slightly, but you can still talk. In other words, you are not completely out of breath, but your body is no longer at rest either. This intensity is accepted in many guidelines as an example of moderate-intensity physical activity. At this point, there is also an important safety framework. If you have heart disease, serious joint problems, chest pain, shortness of breath, balance problems, or a chronic illness, a walking plan may vary from person to person. In such cases, consulting a healthcare professional is the most appropriate approach. This video does not replace diagnosis, treatment, or a personal exercise prescription. Our aim is to explain how walking may work in the body in a scientific but understandable way. So how can a simple movement like walking be so effective on the heart and blood vessels? When you walk, your leg muscles need more oxygen and energy. As this demand increases, the heart starts pumping more blood. The blood vessels have to adapt to the increased blood flow. When this happens again and again, the body may develop adaptations toward a more efficient circulatory system. The reason we say may support here is important. It would not be accurate to say that walking definitely prevents heart disease. However, there is a strong scientific basis showing that regular physical activity is associated with a lower risk of heart disease and stroke. The advantage of walking is that it stimulates the cardiovascular system without placing a very harsh load on it. This is especially important for people who have been inactive for a long time, because starting with very intense exercise can both reduce motivation and increase the risk of injury or excessive strain in some people. The important point here is this: walking is not a sudden heavy load that forces the heart all at once. It is a controlled stimulus given to the circulatory system when repeated regularly. So why is walking so valuable for the heart? Because the heart works like a pump, and regular movement encourages this pump to work in a controlled way. Blood vessels are not passive pipes either. They are living tissues that respond to blood flow, pressure, and the body's needs. Regular movement ensures that this system is used. In a sedentary lifestyle, however, the circulatory system is stimulated less. For this reason, walking can create a simple but meaningful counterbalance, especially for people who spend long hours sitting at a desk. But the effect of walking is not limited to the heart pumping more blood. The same steps can also affect how blood sugar is managed. Have you ever wondered why a short walk after a meal is often recommended? After eating, glucose in the blood, in other words, blood sugar, rises. The body wants to move this glucose into the cells and use it as energy. When muscles move, they need energy. In this situation, muscle cells can use glucose in the blood more actively. This may support blood sugar control and insulin sensitivity. Insulin sensitivity describes how well cells respond to insulin. Simply put, when cells detect the insulin signal better, blood sugar management may become more effective. That is why walking is not only about burning calories, it is also about muscles becoming metabolically active. Muscle tissue is an important organ in the body's energy management. A working muscle behaves differently from an inactive muscle. This is why it is not surprising that short and light walks after meals are associated with positive effects on blood sugar fluctuations, because glucose that rises after a meal can be used more actively by moving muscles. But there is an important limit here. Walking is not a solution that eliminates all the effects of poor nutrition. If total energy intake is constantly very high, if the diet is low in fiber and highly processed, if sleep is very irregular, or if the person is living with a metabolic disease like diabetes, walking alone may not be enough. In other words, walking is not just about spending energy. It gives the muscles a signal to be active. So what does this signal mean for muscles, joints, and daily movement capacity? Walking may look easy, but the body actually performs a small coordination test with every step. While walking, the leg muscles, hip area, ankles, knees, and core muscles continuously work together. This work does not always look like a big and dramatic load. But part of the power of walking comes from this. Small, rhythmic, and repeated signals send a continuous movement message to the body. In this way, daily functions may become easier to maintain. When we say daily function, we can think of climbing stairs, carrying grocery bags, catching public transportation, standing for a long time, doing household chores, or maintaining balance as we get older. Walking does not directly improve all of these skills on its own, but by keeping the body in regular movement, it may help preserve basic capacity. However, we need to correct a misunderstanding here. Walking works the muscles, but it does not completely replace strength training. Especially as age increases, resistance exercises are also important for maintaining muscle mass and muscle strength. So the most balanced approach is this. Walking is the foundation of the movement habit. Strength and balance exercises complete this foundation. For example, while walking supports cardiovascular endurance, simple resistance exercises may support muscle strength and bone health. Balance exercises may also be important, especially in older ages, in terms of reducing the risk of falls. But perhaps the most surprising side of walking is that it can affect not only the body, but also the mind. So why do some people feel lighter not only physically but also mentally after walking? While walking, the body enters a rhythmic pattern of movement. Breathing, steps, muscle movement, and environmental perception create a certain flow. If the walk is done outdoors, additional factors such as daylight, fresh air, and stepping away from screens may also come into play. In the short term, mental relaxation, better preparation for sleep, and improvement in mood may be seen. This effect is not the same for everyone. Some people feel mentally clearer after walking. For some, walking creates a transition space that reduces physical tension after a stressful day. For others, regular walking means a calm and controllable routine within the day. So why might walking be good for the mind? Because walking is not only muscle movement, it is also a regular, rhythmic, and predictable stimulus for the nervous system. This rhythm may reduce mental clutter and lower physical tension in some people. In addition, walking may also be related to biological rhythms, especially when done in the early hours of the day or during daylight. Getting daylight, moving, and not sitting for long periods are among the environmental signals that support the sleep-wake cycle. But here too, we should not exaggerate. Walking is not a treatment on its own for depression, anxiety, or sleep disorders. If symptoms clearly affect daily life, it is important to seek professional support. Walking should be considered here within a safer framework. It may be a supportive habit for mood and stress management, but it should not be seen as the only solution for serious psychological problems.
When people think of walking, the first thing that usually comes to mind is weight loss. But the most common mistake here is reducing walking only to the number on the scale. Weight management cannot be explained only by the question, how much did you move? Energy intake, energy expenditure, appetite, sleep, stress, hormones, nutrition quality, and sustainable habits all play a role together. That is why evaluating walking only through the question, does it make you lose weight, is incomplete. The more accurate question is this: does it reduce inactivity during the day, keep the metabolism more active, and turn into a sustainable habit? The more realistic goal here is this: to think of walking not only for the number on the scale, but also for general energy, fitness, sleep, metabolic health, and less inactivity. Because sometimes the change on the scale may be slow, but a person may notice that they breathe more comfortably, struggle less while climbing stairs, feel less sluggish during the day, or sleep more regularly. These are also important indicators for health. The first misconception: if you don't take 10,000 steps, there's no benefit. This is not true. 10,000 steps can be a practical and memorable goal, but it is not a mandatory threshold for everyone. For some people, going from 3,000 steps to 5,000 may be meaningful progress. For others, duration, pace, or regularity may be a more suitable measure. The second misconception: walking solves everything. Walking is a powerful habit, but it is not the only tool that solves all health problems. Nutrition, sleep, stress, genetic factors, medical history, and environmental conditions all affect the results. The third misconception: the faster you walk, the better. Not always. A very fast pace may increase joint pain, shortness of breath, or the risk of injury in some people. Especially for beginners, sustainability is often more important than speed. The fourth misconception: I walk, so I don't need any other exercise. Walking is very valuable, but strength and balance exercises are also important for muscle strength, bone health, and balance. Especially as age increases, these complementary exercises become even more meaningful. Where is the scientific uncertainty? The effect of walking varies from person to person. Age, weight, starting fitness level, sleep, nutrition, pace, walking surface, shoes, medical history, and total amount of movement can affect the outcome. That is why, instead of one correct step count for everyone, the more realistic goal is this: knowing your own starting point, increasing movement safely, and making it regular. We can think of regular walking as a small but versatile signal for the body. A single walk does not create a miracle, but repeated walks create a regular stimulus for the heart, blood vessels, muscles, metabolism, and nervous system. A 3-point summary. Number 1. Walking is strongly associated with cardiovascular and metabolic health. Regular, moderate-paced walking is associated with positive effects on blood pressure, blood sugar control, circulatory capacity, and overall physical fitness. Number 2. Walking may affect not only the body, but also the mind. It is associated with supportive effects on the stress response, sleep quality, feelings of anxiety, and mood. Number 3. Walking is not a miracle, but a sustainable foundation. The best results usually appear when walking is considered together with sleep, nutrition, strength exercise, and overall lifestyle. The main message is this: regular walking is not a simple prescription that solves everything, but for most people, it is one of the most accessible starting points for a more active, more balanced, and more sustainable life. You can share this in the comments. What is the biggest obstacle that makes regular walking difficult for you? Time, motivation, weather, or building the habit? For scientific and understandable health content like this, don't forget to like the video and subscribe to the channel.